Hi, all. Thanks so much for joining us on Speaking of Making Healthcare Work for You, Different Perspectives and Empowering Solutions. I'm Stephanie Fields, joined by my co-host, Dr. Apoorv Gupta, and today we are talking about our interview with Dr. Uli Chettipally, who is the founder of the InnovatorMD Network, and he was a co-founder and former CTO of the CREST Network that is part of Kaiser Permanente. And I really enjoyed his interview because I thought it was so cool how he came full circle, how he worked as an emergency physician with Kaiser Permanente and worked with the CREST Network, formed it. And they learned so much using electronic health records and layering data on top of that, or layering a tool on top of it to get the data out of it to provide better care to their patients. And I thought it was really cool that he did that. And then after he retired, he went on and formed the Innovator MD group that he has now, where he's helping other physicians who are either just starting their career and want to go into maybe a tech startup, or who are retiring, or maybe considering a mid-career change. And they're also using tools that are using that same type of thinking and strategy that he was using at the CREST Network to use data to provide better care for the patients. And one of the things that he kept talking about that was so important through all of this data is the ability to let the machine do the work and take that cognitive burden off of the doctors who are just working so hard to do the right thing for the patient. Apoorv, what did you think about it?
You captured it so well, Stephanie. Again, I always impressed by you and what you get out of these conversations. I go exactly back to what you're saying. I loved his message of punish the machine. It's the title of a book that he's written, so we all need to check that out. And what he means by that is that the machine is really the computer systems, the technology that's already there. It's already available. We're just not using it. Unfortunately, what that means is that we're punishing our doctors, we're punishing our nurses, we're punishing our patients because we're putting them through the rigor. We have the data already available, we have the technology already available. We should be using that technology to harness the real live, real-time data that can then immediately turn right back around and come back to guide our thought process for the patients that are right in front of us. Instead of taking 10 to 15 years to do background research, publish the studies, then come up with guidelines and then get that in front of the physicians and hope that they're going to put that into practice. This is just a much more practical, right up front way of using the systems that we already have. So punish the machine is what I got out of this. I love that thought process. I'm going to try to implement that myself, and more power to Uli and to all the companies that he's trying to mentor.
Absolutely. I 100% agree. I love that. And I hope that you all stay tuned for the full interview because it's really fascinating. We'll talk to you soon. Bye bye.
Bye bye.